All right, Bob, thank you. The death of a man in police custody in Minneapolis is now sparking new conversations all around the world.
That's right. And this morning we're talking about something called unconscious bias. It's a term that you may hear more often these days. And we're joined live by Moimoy Hen McCormick. She is the Clinical Director of Adult Residential Services at Rushford Center. Good morning. Thank you so much for joining us. This has been a difficult time for our country. It is a heartbreaking situation, but also a hopeful one because it could be a tipping point, some say, for change and for reflection. And so can you define what is unconscious bias?
Good morning. Thank you for this opportunity. And yes, it's definitely been an emotional roller coaster for everybody. First off, I do want to say that unconscious bias, everybody does have. So it doesn't mean that, individuals are bad people. This is something that each of us do have without realizing. Simple definition of unconscious bias. It's also known as implicit bias. It's really a prejudice that we act on without realizing, without having all of the information or all the facts, and then we react to.
Okay, I'm sure most of us do not want to think of ourselves as biased. So how can somebody pinpoint their learned biases and undo something that they may not even know that they have?
So this is something that Rushford is doing along with the Behavioral Health Network, Institute of Living. We are all part of the Hartford Healthcare System. One of the main things that we are doing currently with staff is we are holding these courageous conversations or let's talk conversations. We are allowing staff time to be able to share with each other and process and ask those difficult questions. Racism is really difficult to talk about to begin with. And now with these activities that have been going on that people have witnessed, it makes it even more challenging for us to be able to talk about. But I think we have to push it to the forefront and create those opportunities for everybody to talk about. We can talk about with our children, age appropriate wise. We can talk about with our family and friends. We can talk about with coworkers, colleagues.
Yeah, and going back to the concept of unconscious bias, can you give us some examples of what is this informed by? Where do we soak up these kind of attitudes in our lifetimes?
Absolutely. That's a great question. Unconscious bias really stems from learned behaviors, our environment. What we're taught, what we see through the media, through social media, conversations that you're having, your upbringing, your experience. It draws from your personal experience. It draws from, people that you interact with, whether it's a closed group or a larger group. That's one of the ways that we actually can address the unconscious bias is expand your network. If you're used to socializing with or interacting with a certain amount of group, or you don't know about another community, great opportunity to be able to explore and research and introduce yourself or get to know different communities or do different things that are culturally, different from what you're used to.
All right. Moimoy Hen McCormick, is there anything else you'd like to add for our viewers?
I think it's really, what a lot of people have already been saying. It's treat people as human beings. We may look different. We may have different upbringings, but ultimately we are, human beings. We need to be all respected. It's really about respecting each other, trying to gain equality for everybody. And I think as long as we have open minds and we're able to have those courageous conversations without reacting, and let people know if something is offensive. That also creates dialogue for, misunderstandings and to be able to discuss things further as well.
All right. Moimoy Hen McCormick, Clinical Director at Rushford Center. Thank you so much for making time and for helping us continue this very important conversation.
Thank you so much for the opportunity.